All right, without further ado, I'm going to hand the microphone over to our panelists today. We're talking about the new healthcare law, or Obamacare, and we're going to hand it over to the experts here.
Good afternoon. I'm David Call with Call Insurance, do the life and health for Adams and Brown Insurance, and we work in North Arden, and we are independent, and so we work on your behalf to find you the best plan for you.
I'm about Stoney, South Asheville Chiropractic. I have a page before you. There's a nice infographic on there, but it didn't reproduce small exactly as it should have, so if you really want to see it, yeah, you can just email me and I'll flip it to you in the file.
Edwin Chamberlain, 1040 on Wheels, mobile tax service, weekly meals.
Okay, so we've all heard about the reforms that are going to happen, and what I'm going to do today is try to touch the topics that are probably going to affect most of us. Of course, it's going to affect every individual and every company, but because most of us are small business owners or work for a small business, that's what I'm really going to focus on. And if you have this sheet right here, I'm not going to cover everything on here, but what I'll do is everybody has my card. If you would like, I have a lot more information, specific information on this, both for the individual and for the companies, and I can get that information to you. Also, we can do a free sit down and go through it with you, whether it's for you and your employees or for yourself. So what I'm going to start off with is I'm going to go through a short timeline of the different changes that are happening, and I'm going to focus specifically on the health insurance, and as he is going to focus on, each of us are going to focus on a specific topic. So starting with 2010, March 23rd of 2010, there was a tax credit of 35% for small business owners for offering health insurance. September 23rd was the cutoff for grandfather plans, which means, for example, if you had an HSA, the maximum funding was $3,500 a year. If you already have that plan from September 23rd of 2010, you can continue that plan. Also, for the business owners that have an insurance plan for the employees, you're able to keep that plan as long as it meets the requirements that the government have. As of January 1st, 2013, HSA plans were limited to $2,500 per year. And I'm going to touch base specifically on that a little bit more. But basically what that means is an HSA, or health savings account, is a plan that normally has a high deductible, $2,500 or a $5,000 deductible for hospitalization. It does not cover doctor's visits, but you actually fund your own health savings account, and it's tax deductible. So if you visit your doctor for prescriptions or whatever, you swipe your card and it comes out of your own HSA, your own health savings account. But as of January 1st, 2013, it has been limited to $2,500 per year. As of January 1st, 2014, this is the big date you want to remember, but that's when all Americans will be required to have health insurance, and employers with 50 employees or more will be required to provide health insurance for their employees. If you have 50 or less, there will be a tax benefit, which he will get into in more detail later. And as of January 1st, 2014, also, it will go from 35% to a 50% tax increase. All right, and then the groups over 100 employees usually have an 18% advantage in cost because of being a large group. As of 2014, there will be programs to help small businesses, 100 employees or less, be able to get the same benefits as what a large group would get. And so very briefly, I'm going to go through a couple of different solutions for individuals and small business owners. Number one is very important to work with an agent versus getting your health insurance just through directly online, just because it's very important to know how the laws are going to affect you and for your employees, and being able to sit down with a knowledgeable agent that can guide you through the different processes that are going and the timelines that how it's going to affect you is very important. And as I said before, if you would like more specific information, please let me know. Everybody has my card, and we can sit down with you and walk you through the different changes that are going to be happening. All right. And what I want to talk about also is specifically the HSA, the health savings accounts. Just by a show of hands, does anybody understand what the health savings account is? Okay, very good. A lot of, especially small business owners, they're in a position where they are not offering a group health plan for the employees, but they need some type of health insurance. And basically the purpose of the HSA is so a lot of people will have a low deductible plan or a $1,000 deductible plan, and they'll have covered doctor's visits, and they're paying a couple $100 more for a regular health insurance plan rather than an HSA, but they're only going to the doctor a couple times a year. And so what happens is, if you're not saving, if you're not going to the doctor every month, and you're paying a couple $100 more for your health insurance plan, then it's not a good solution. What the HSA does for people, rather than just having a high deductible plan and putting money aside in the bank accounts, you can put it in a health savings account, so that way you can write it off on your taxes. So when you go to the doctor, not only do you have your health savings account, but you still have the network, so you can go to the doctor within the network and you get discounts, but then you have a card that you can swipe and you pay directly out of your own HSA account. And most of the HSAs, once you hit your maximum deductible, it picks up 100%. So if you have a $2,500 deductible or a $5,000 deductible and you're hospitalized, you're able to, you go to the hospital, you're responsible for the first, the $2,500, the $5,000 deductible, and then it picks up from there. And so the specific detailed information for the timeline I do have. Just let me know if you need that. I actually have it in the car. You can let me know and we can go through in more detail.
I have a car, but I can't afford the gas. And that might be what the problem's going to be with the doctor shortage. January 2014, all these people are going to be insured, but who's going to see them? It's been a year or so, and it's been all over the news. Yeah, I'm sure you've seen it. There's going to be a doctor shortage. And a lot of it's going to be because of the higher demand. We've got everybody on the rolls now. But there are many other reasons for this unintended consequence. Even before the law, we were short on physicians in this country. It was just last week or the week before, there was a large hospital group out in central New York that they had to turn their patients away to another hospital group because they just can't get the surgeons to fill slots. Also, we have 20 years of the boomers reaching retirement age, and they always use more services. I think it's going to be about 20 years before all the boomers, that the boomer bulge gets over, isn't it? Something like that. We have around a 10% increase in population per decade expected. So, of course, that's going to be another requirement for more services. A third of physicians are near retirement age, and medical school admissions are down, on top of which it takes about 10 years to win a new physician. So we're 2014, everybody's going to be on the roll, but who's going to see them? And it doesn't seem to have been addressed appropriately. I see very little that the government's done to address this problem. In the past, they've had, for underserved communities, they've had student loan forgiveness and things like that, but let's face it, you're already in the hole and you got 10 years to win a new position. What are you going to do? Another problem is a lot of physicians are saying they're going to give up practice, and that's one thing where I'd really like to see if anybody here knows a physician who's going to give up practice due to Obamacare. I know one surgeon who says he's out of here. 3 more years, he'll have enough money, done. Does anybody else know a physician that says Obamacare, done, leaving practice? Yeah, you do? How about secondarily? I know secondarily 2 physicians, PCPs, who are done. One of them closed the doors just recently. Anybody know at least secondhand information? No? Well, the surveys are showing that there's a ton of doctors that are just finished. They don't want any part of it. The physician survey of 13,000 plus physicians, half plan on cutting back on patients, switching to cash only to avoid the Obamacare situation, or quitting over the next 3 years, like the surgeon I was mentioning. 60% say they'll retire if they can. Another problem which you might not think of, physicians report working 6% fewer hours than they did 4 years ago. And that represents tens of millions of fewer doctor-patient encounters a year. Now, one thing that we're going to get with Obamacare apparently is preventive care services, and they're supposed to be offered to everybody, no deductibles, no out-of-pocket. So all gets eaten up by the insurance company. And there's a huge list of preventive services. I didn't count it out. I didn't see the number. It must be 40 different services. Things like alcohol addiction counseling, like fecal occult blood testing, things like that. And a lot of these people that are wringing their hands over the potential problem of not having enough physicians to meet our demands is this mandate of preventive care. And I'm going to read to you what this hand-wringer had to say. Obamacare says the health insurance must cover the tests and procedures recommended by the U.S. Preventive Task Services Force. What would that involve? In the American Journal of Public Health, Duke researchers calculated that arranging for and counseling patients about all those screenings would require 1,773 hours of the average primary care physician's time each year, or 7.4 hours per working day. Well, a lot of this is just complete nonsense, of course. You know, when was the last time you saw your doctor do an X-ray or draw blood? When was the last time? I don't do either of them in the office. I send it out. My PCP, he sends it out. So that's just complete nonsense. Other people are doing that kind of stuff. But I really bring this up because what are we going to do? We do not have enough physicians. Well, what we're going to do is all these tasks can be pushed off on allied health professionals, being picked up by our PAs and our NPs. And we already do a lot of this stuff now. So it's, I guess what I'm here to say is the sky is probably not falling, but it's sure as heck going to sag down a lot. All right. So as far as what the terrain is going to look like, back in 2006, Obamacare came to Massachusetts, and it was around that time, 2006, 2007, I started seeing articles about concierge practices, and most of these were in the Northeast. Primarily they were in Massachusetts, of course, and that was because of Obamacare. And if you've not heard of it, concierge practice, the physicians in the practice will take you in, you will pay, say, $1,000, $2,000 per year per individual, and that will guarantee you access to the physicians in the practice. They in turn will just slash the numbers of members of their practice so that they have time to devote to you. And they'll do things like advocate for you. They'll be available to you, or someone will, 24 hours a day. Appointments will be same day, next day. Of course, when I see things like that, I think, well, that's what I demand in my position now. But that's the situation with concierge practices. And a lot of people are going to them already, and many more are expected to be established because the physicians don't want any part of Obamacare. Now, California's already short of Medicaid providers, and they've been pushing really hard to get ahead of the whole problem with physicians in Obamacare, black physicians. So what they've done is started trying to decide how they're going to get nurse practitioners to have outside practices, medical doctors, and physician's assistants. Of course, they're under the medical doctor's thumb. Everything they do has to be reviewed by the medical doctor. And it's looking like those two professions are going to have to break out because we need more practitioners. It's already been seen in research that both of those can account for 80% of patients' needs. So it's a triage thing, which we're already doing right now. I have people who come in and I'll get paperwork from them from some doctor's office, and they'll say the doctor gave me this, whatever, and it's not their physician, it's the PA right off. It's stuff already being done. So maybe the sky's not falling. One other thing California's doing is they're suggesting that optometrists and pharmacists provide PCP type care, and I don't know how that's going to work out. Certainly pharmacists are already underutilized, but you look at, say, over the past couple of years, we're having the flu jab is being given by pharmacists here in the country. In both these cases, there's been a lot of pushback of organized medicine, as you'd expect. It's been within the last 10 years that the AMA had a group formed to look at nurse practitioners, and as usual, is on the guise of patient protection. So yeah, there's going to be some pushback. Right now in California, there's some serious pushback against the nurse practitioners and suggestions that they establish their own practices. Now, when I first heard this as a potential problem, I figured we were going to see foreign doctors just flooding the place. If we need more doctors, they're out there. I figured it's going to be Filipinos and Indians everywhere. But the problem with that is, with our system now, these foreign doctors, if they have a license from a foreign institution that's recognized here, they still have to take testing to show competency, naturally, and then they have to take testing to show proficiency in English. But after that, they have to go into residency, and there aren't any rooms for them in the residency. So they're being held out. It's really dismal, the numbers of foreign doctors that are able to be licensed here. So before that could ever help us out in our problem, we've got the problem coming, right? Next year, January 1, all those people on the rolls. Big changes would have to be made to our medical schools and the way we handle residency in this country. All right. So what's going to happen? Obviously, there's going to be longer waits for care. And on that infographic, there was a thing about Obamacare, how once it was instituted, the national average for a new patient getting appointed to a practice was something like a week or 2 weeks. And then under Obamacare, for the people in Massachusetts, it became 2 months. Long waits for care. Who knows how long your wait for care is going to be? Everyone was so anxious for us to have a Canadian style medical system, and I'd like to give a little anecdote about that. I had a patient I was working on a knee, and he goes, what's wrong with the knees? Oh, I just had surgery. It's not in the history. Come on, what are you doing to me here? So he had surgery. He's in Canada. He's a Canadian, and he had a hard time getting in to see his PCP. Finally gets in there. And the guy says, okay, it's, I don't remember what it was, meniscus tear or ACL, whatever. And the guy says, we're going to have to get you to the surgeon. It's going to take 2.5, maybe 3 months. I can't wait that long. So his PCP told him, well, what you could do is you could go to the hospital and you could fall down in the ER and start screaming. And that will push you up to the front of the line. Instead of being a wealthy individual, he just crossed over to the U.S. and had it taken care of within a couple weeks. Is that saying I need to move along? You said 10 minutes. All right. Lastly then, only bit of advice I could really give for you right here is something I saw which I thought was pretty wise, and it's you better get into a practice now if you want a PCP. And it might be very wise if you went into a practice with multiple doctors, or group practice. Because it could be a long wait if you wait till everybody's thrown on the rolls, and some decide that they're going concierge, and some others get out. Another thing to consider I read, which I thought was very wise, is look at your doctor. Is he going to be practicing much longer? especially with your parents. A lot of our parents have doctors they've had for years, and those guys are facing retirement. It's time to find somebody that's going to be there for you in the near future at least, and get on their rolls now. And that's all I have for you today. Thank you very much. Faint applause, I appreciate it.
All right, I'm the tax guy on the panel, and so taxes are what I'm prepared to talk about. In particular, this book is the text for the update course that I took to prepare for this upcoming season. About half of it has to do with tax aspects of Obamacare. I obviously don't have time to cover all that. Besides, most of it doesn't come into effect this year or next, which are what I'm focused on. Let's talk about the individual mandate. Starting in 2014, everybody's supposed to have health care if you don't have health insurance. If you don't have health insurance, the tax system may impose a penalty. Not if you're not required to file, not if you get a hardship exemption, but there's some other exceptions. Not if you belong to a religious sect that is opposed to health insurance. Most people don't meet any of the exceptions, so most people will be required before they can finish their 1040 to indicate whether they were covered and fill out a penalty if they were not. Oh, by the way, you can go 3 months uncovered, and that will be forgiven if it was only 3 months. So the thing is, the IRS is forbidden to enforce the penalty by lien and levy. All they can do is take the rest of your refund. So what you do is you plan your withholding so that you owe them, and there's literally nothing they can do about it. So all in all, I think it's going to be okay as far as the individual mandate goes. I think people are going to be better off with health insurance than without, and I think that there will also be credits available for low-income people. There's also a credit coming from small business, already in effect as a matter of fact, for small businesses that provide health care. The IRS estimates that fewer than 35% of eligible businesses are taking advantage of this credit, but it can pay as much as 35% of your business's healthcare costs. And of course, we all know that starting soon, I don't think it's 2014, and I've forgotten when it hits, but eventually businesses are going to be expected to provide health care for employees, and will pay a penalty if they do not. However, again, there are exceptions. The only people you pay a penalty on are those who go to the state exchange and get a rebate, government funding of their part of their costs. And so that can't happen if, as in North Carolina, the government does not set up an exchange. So that if you've heard that Governor McCrory is not going to set up an exchange, that's why he wants to protect employers from that particular facet of the law. And as long as he doesn't create an exchange, there will be a national exchange that North Carolinians can go to, but it won't send the dreaded notices to employers, And so employers who do business only in North Carolina won't have to worry about that particular penalty. And I think we're going to open the floor now for questions.
First, I'll say thank you to our three panelists for presenting information. A little round of applause here for them. It's always easier to sit in the audience than to sit up here, so they did a great job. I'm going to open up the floor to questions. So who's got the first question? Wayne?
Well, you can speak into the microphone too.
The question I have is, how does Obamacare take into consideration alternative health care? I personally am not a big fan and only use it if I absolutely have to, what they call traditional medicine, which is actually more of the modern medicine as opposed to the traditional, which is the alternative care. But will Obamacare, can you use that to go to like chiropractors, acupuncturists, nutritionists, massage therapists, or that sort of thing?
From what I've seen so far, very little change from my practice.
Al, yeah, I haven't seen.
You haven't seen?
I haven't seen much in terms of, well, any of the information I have, I haven't seen much change specifically for the area. I think same thing.
Yeah, everybody's being forced to get insurance, and so some plans are going to say you get this, and some plans are going to say you get that. It's really no change that I can see. I mean, if anything, it's always possible that with the preventive care stuff, because I can do fecal occult blood test, I can do nutritional counseling, and I do all those things. That may be more money in it for me. I don't know, more services, but. As far as access, I see no change.
I don't believe that alternative care such as acupuncture and all is in what policies have to have. But again, if the market says that people want that, then it will tend to be included because people will flock. Some policies will offer it and people will flock to those policies.
In other words, no change.
Yeah.
Next question. Who's got another question for the panel? Philip?
Just out of curiosity, how is Big Brother IRS going to know whether I have health insurance or not?
You will be required to answer the question, do you or don't you, under penalty of perjury, with your as part of filing your 1040. If you are not required to file, then you would be among those not required to have health insurance. But you will, if you paper file without answering that question, it'll come back to you just as it would if you paper filed without signing it. If you electronically file without answering that question, it will reject just as if it would reject if you had left off your social security number.
Debbie, you have a question?
Hi. I really want to know, bottom line, I am an individual, I am self-employed. I don't have health insurance. I don't have a primary care physician. I'm very healthy, thank God, and my primary care physician is a chiropractor, okay? In the foreseeable future, I don't see myself needing to go to traditional doctor. And I'm with Wayne. I would prefer to have alternative medicine. Bottom line, what's it going to cost me, because I don't need insurance, I don't want insurance, and I don't have an employer, what's it going to cost me? What is the penalty exactly? Thank you.
It starts at 95. How much?
It starts at $95. It goes up.
So I'm going to pay $95 just to be healthy and not have insurance.
Per year, that's a year.
And then after you also have a month.
If y'all are going to answer, if we could do it with the microphone recording.
I don't. I could get the exact number for you. I don't have it in front of me. It's definitely $95 the first year, 2014, and then it starts going up per person in the family to where it gets. Yeah, you might as well. You could probably eventually get a deductible plan for less than what the penalty will be. And so maybe not the first year. For some people, it may be better to pay the penalty if they use alternative medicine, which I do a lot. But eventually, it will get very expensive. Do you have the exact number?
Yes. Okay, drum roll. For 2014, the penalty is the greater of $95 or 1.0% of household income over the threshold amount. For 2015, it is the greater of $325 or 2% of household income over the threshold amount. For 2015 and 2016 and after, $635 or 2.5%, and for years after 2016, that is indexed for inflation.
But don't worry, if you're in poverty, the threshold amount is $45,000, so you're good.
So we have
You're
no
golden.
incentive to make
Yeah, but that's not, yeah, that's not great. I'm terrified. Sorry to feel like there.
Actually, I want to ask the next question real quick, and then we'll get to you next. So, I don't know if you guys can talk about this, but I know there are a lot of legal challenges to this tax that's been placed on the American people, and yeah, you can see where I stand on this. But what do you see right now, if any of these challenges, for example, the states, some of the states are fighting it, what do you see happening with this healthcare plan if a lot of states do not participate or there are further legal challenges? Obviously, things have to start being put in place. Mechanics are being put in place. What do you see going on with that?
If your state does not set up an exchange, you may use the federal exchange at least. It is also possible that other states have the option of opening their exchange to some or all people who do not live in their state. They can say only in the states that border us, or they can say the whole country is welcome in Oklahoma, whatever. And so you will have at least one exchange that will be open to you, and that if it works as designed, it will make available to individuals the cost discounts that right now only go to large groups.
Right, my question though is if, I'm going to pay the tax. I have a problem with my government telling me what I have to buy. So my question is, do you see with the challenges that are going on now, that some of these costs might get compromised down, or any other possibilities where they might start to allow you to opt out if you are participating in alternative care, for example?
I expect you can get out under the hardship provision if you really want to.
Well, I'm a small business. I can show them making no money.
Yeah. I expect you can get out, and I'll be glad to talk to you individually about that.
You just need a waiver, Joya. Join the union.
I don't have a question, I just kind of have a comment of selling health insurance for 18 years. And I think the important thing to remember is, you still don't have to buy it if you're willing to pay the penalty. But the one thing that I did find out this week was, my big question was, what's the incentive to buy it and not wait until your house is burning? And the thing that is going to keep people thinking about possibly wanting to sign up for health insurance is that there's going to be an open enrollment. The first year is going to be 6 months, and then in 2014 it's going to be a really short open enrollment. And I really, respect and appreciate all the alternative care medicine that we have here in Asheville. I mean, it makes up a large majority of our small group businesses. But, unfortunately, we're not all, exempt from not having getting diagnosed with a dreaded disease. And I've sold many, many, many policies where people have come to me and they've been extremely healthy and they've been diagnosed with a dreaded disease that costs them all kinds of money, thousands and thousands of dollars.
They couldn't have been
monthly.
extremely healthy if they had a dread disease. They were very, very, very unhealthy even appeared.
Well, I'm just trying to say that we're not all invincible from not getting the cancer or whatever.
I'll accept that for
So,
sure.
and I just want to have the option of being able to go out and shop my health care. And if I don't have health insurance, I'm not going to be able to shop my medical care. So, my 2 cents worth.
Did you want to go?
I just want to make sure I understand. What's your name again, sir?
Edwin Chamberlain.
Edwin. I want to make sure that I understand. You said that the IRS can't charge us the penalty. So if we've paid more in for the year, they can withhold the penalty if we haven't paid
Right.
insurance. However, if we don't pay more and we end up owing for the previous year, then they can't charge us that penalty because they don't have the money.
They can write you all kinds of letters and they can seize your federal and state refund, but they cannot levy your bank account or tax your paycheck
Or put us in jail.
or put you in jail.
So basically, there's no way to. So basically, if I set up my system paying taxes in a way that prevents me from getting a refund or wanting a refund, then I don't have to pay the penalty.
That is correct under current law. The penalty is under a whole section of the Internal Revenue Code. There's a whole bunch of taxes where they can't lien or levy you. And I can't think of any others off the top of my head, but there's a whole section of the code. And so I don't see this changing. I think Congress knew exactly what they were doing when they wrote the law that way, and they must have wanted it to be that way.
Thank you.
I gotta see if there's a question embedded in my diatribe, but I am that person that you described. My kids are on Medicaid. I am below the poverty level. There is nothing in place to incentivize me as a small business owner to save
How easy it is to
money.
find somebody right now with a Medicaid provider? I don't do Medicaid.
It's great. It's easy.
It's
Great.
easy to find?
But it's not golden for the record. So I don't feel good about it. I don't like it. I don't want to be in this position. It is very easy for me, but there's nothing in place in the government to incentivize me to get better. And is there anything in place for people like me to get better? So now everybody's going to be given these options, and where's the
carrot? I don't see it.
incentive to have an IRA and to have a savings account and to save money instead of putting it under the mattress? I want to know where that is, and is it going to change, and how does that change for my kids when all this takes place?
There is a credit that will be available to when you buy from the exchange. If your income is relatively low, you will pay less for the same policy than someone who has more money.
So what about when you get just over that line, right?
That's the problem.
Okay.
But the line is fairly generous. I think it's approximately $45,000 for a single individual.
But there's nothing put in place to help those people that are in between.
That's true. Up to a certain point, you get help, and then $1 more than that, and you get none.
So I'll just keep looking under the ground.
Yep.
Okay.
Next question.
I'm just curious, it seems to be a lot of folks in this room that are into alternative care. How many, if you're comfortable saying, how many people would like to opt out of the Obamacare? That's a pretty huge percentage, I'm going to say, out of this sort of group of entrepreneurs, and we have so much talent in this room that somebody can make a business out of that one little tidbit of data.
Or start a 501c3 church that exists exempt.
We're already thinking about it.
Yeah.
Yeah.
That's the easy one, but maybe there's a profit center that would actually get you chiropractic care, acupuncture, whatever thing, you know, to maintenance your insurance, to maintenance your health, so that you stay in perfect health and excellent health.
Just remember that to qualify under the law, it would also have to offer the more mainstream alternatives.
Okay, good question. I have insurance now. How will that affect my current insurance?
If you like your policy, you're grandfathered in, and it's acceptable even if it, for some reason, doesn't meet the standards to take a new enrollee.
Okay, just keep what you got.
Yeah. If you like your insurance, you can keep it, assuming that what you have in life is actually insurance. It isn't Ameriplan or whatever medical discount plan.
And are you speaking of individual or group?
Group.
Yeah, it is. There are certain requirements, and of course, for time there's not time to go through those. There are certain requirements that you have to meet for the plan to be grandfathered in. But it would be good, of course, to review your current plan with what the changes are going, with the changes that are going to be taking place in 2014.
You guys have a question?
How is the changes going to affect plans, like you mentioned, Ameriplan, I believe? How is that gonna? Will that be acceptable, or?
I don't know. That would be left up to the marketplace. The law does not change medical discount plans such as Ameriplan. It's just a matter of, with more people insured, will people still choose to buy these plans? I think they're a bargain, and I noticed that most of the insurance I've looked at over the years had something similar built in. They didn't want you to buy Ameriplan, they wanted you to buy their rider. So I'm guessing Ameriplan is safe. I know that company. I have a fair amount of respect for the guys who founded it, even though I can't think of their name right off. I don't think they would have started something that was going to be blown away by this.
Any last questions?
I have one last one. So for people that, if I consider having insurance and I'm debating it, and I will be probably under the $45,000 income, would there be a specific insurance company that can provide subsidies or help, for the lower income, or every insurance company would have to have a certain plan that would cater to people like that?
Yep. If you look on this form, the fourth point down, 2014, small businesses will generally fewer than 100 employees can shop in an affordable insurance exchange, which gives the power similar to what large businesses to get better choices for the lower prices. An exchange is a new marketplace where individuals and small businesses can buy affordable health benefit plans. You see where that is?
I see.
The fourth one down.
Yeah.
How that all works, I'm not sure, but there is going to be some type of plan.
And in North Carolina, apparently, at least for a while, we will be dealing with the federal exchange, but that won't change the principle of what is supposed to be going on.
How does this affect Medicare and these Medicare supplement plans?
I don't have much any information on it.
My understanding is that you will still need Medicare will qualify as as adequate insurance to meet the terms of the law, but Medigap policies will continue to be marketed and sold, and probably through the exchanges as well. So if you wanted to rely on nothing but Medicare, but if you wanted the Medigap policy that most people have now, also available.
Any last questions? I think that's probably the best Q&A we've ever had. I appreciate all the questions in the audience, and thank you to the panelists.